We've got a So, good afternoon, Hadi, and kia ora koutou to those of you joining us from Aotearoa, New Zealand. My name is Margo Parks, and it is a real pleasure to welcome you here today for this very important celebratory moment, a special Health Research Institute seminar honouring and profiling the work of Dr. Margo Greenwood and the National Collaborating Centre for Indigenous Health. I'm here today with several different hats on. We're delighted that we're being joined from people across Turtle Island, but here on Kaitaitanei territory, we have a group of us in the room today. We're gathering, of course, under different conditions than we might, but we're really delighted to have brought together a group of people to be part of this important presentation and also to be connecting and sharing with those of you that are joining us from online. So this is a particular kind of presentation. The Health Research Institute has a regular monthly seminar series that we're really proud of, but we're also really proud to make exceptions for exceptional circumstances. And this is one of them. Dr. Greenwood, certainly from my point of view, I'm standing here with several roles. I am a professor in the School of Health Sciences here at UNBC. I'm cross-appointed with the Northern Medical Program and the new Division of Medical Sciences. But I'm also recently the co-lead of the Health Research Institute. I teach and research from UNBC, and I've been doing so on Kaitaitanei and DAC Health territories for the last 12 or so years. And throughout that time, Dr. Greenwood has been a big presence. I even think in my first days coming to UNBC, that was the case, and very memorable to meet this kind of leadership in its own right, and of course, with spectacular impacts as an Indigenous leader and scholar and influencer. So today, what we're going to do is to importantly begin with a welcome to the territory that we stand on. And I'm really delighted that to do that with us, I'm inviting up Elder Darlene McIntosh, who has been such a profound impact on so many of us that are living and working on these territories. And I know has interacted with Margo, the other Margo Greenwood, over a long period of time. So we're going to begin with a welcome and have a couple of other introductory remarks before we get to hearing from Dr. Greenwood. So, Elder McIntosh, my pleasure to welcome you here, and I'll just step aside over here. Howdy. Hey.
Oh, you guys are too quiet. I want you to say the biggest, loudest Hadi that you can. Hadi. Hadi. Better. So of course, I'm saying hello to you in the carrier language. And it is absolutely my honor and pleasure to be here to be present to Dr. Margo Greenwood's presentation and to acknowledge and celebrate her accomplishments. So there's a couple of things that I'm going to do. I'll give you a traditional welcome first and foremost. But what I want you to do first of all is, this is such an exciting time. It is after 2:30, and it is a Thursday, and it's winter and dark out there, and yeah, we all feel a little bit draggy, don't we? We're overwhelmed, we're overworked, and so the first thing I want you to do is close your eyes. Just for this moment in time, I want you to close your eyes. So as you close your eyes, I want you to take a nice deep cleansing breath throughout your whole body. Nice deep cleansing breath. So we pull that breath through our nose and then gradually let a long, slow exhale out of our mouth. And as we take a couple of those breaths in, we find ourselves settling back into our our temple, our physical body. And this year is all about self-care. So it's about taking care of yourself. So we might as well start right here. So as we breathe into our body, we're letting go of the burdens on our shoulders, the stresses, the anxieties, the fears that are happening in our world today. And you can feel those burdens start to lift off your shoulders. Feel them slide down your arms, down your fingertips, and gently fall on Mother Earth. And there, Mother Earth will transmute those energies into a positive energy, giving them back to you to energize you rather than to deplete you. And then just imagine yourself outside on this beautiful winter day. We've had lots of snow. And we have to honor the energies of winter. And how many times do we ever do that? You know, we have 4 seasons for a reason. And winter is about being calm, going inward, and just not being busy. And do we ever allow ourselves to breathe in the beautiful energy of winter? No, we're too busy. We're always doing something. So we need to connect to our environment. So it gives us the energy to be calm and come back to ourselves in a good way. So imagine yourself outside today. It's a little bit cool, snowy, got your boots on. You're standing on beautiful Mother Earth facing the east direction. And there, we know early in the morning, the sun always rises, gives us a new day, a new beginning, and new possibilities. And every day we have that opportunity. So we breathe down into our feet. And we know that our feet can't settle into the beautiful soil of Mother Earth, but we can just imagine them. We can smell the richness of her soil. And there she grounds us into today, into this very moment, to be present to what will be taking place, bringing all of our attention here to honor and celebrate and learn, listen. We collaborate. We, the Clayton Tenay Nation, have been on our traditional lands over 9,000 years, as supported by lithic evidence. The changes that have taken place over thousands of years supports the enduring strength, courage, and fortitude of our peoples. Our governance through the Batlas brought balance and harmony with our brothers and sisters of other First Nations people. Clayton Tenay's clans are Frog, Lasilu, Grouse Utsut, Beaver Saw, and Bear Sus. Through this system, we know who our family connections are. Through our oral history, the use of legends told of our travels, our hunting and fishing territories, our trading practices with all peoples. May remember and hold steadfast in what Creator's blessed us with, and that is our traditional territories. Our ancestors have always welcomed people to our territories. On behalf of Clayton Tenay's elders, our youth, community members, and chief and council, it is absolutely our honor to welcome each and every one of you to our traditional territories. So as we continue being in our own sacred space, we want to bow our heads and connect at a deeper level again. So we call on the Creator, the grandfathers and the grandmothers, and all of our ancestors to come be with us today. We thank you for this beautiful day on Mother Earth. We thank you for the gift of community. And thank you for bringing all those present for the celebration and acknowledgement of Dr. Margo Greenwood, who has been appointed as an officer of the Order of Canada. This prestigious award honors individuals from across Canada who have made extraordinary contributions to the nation. As a teaching professional working with Aboriginal and non-Aboriginal peoples, you have been blessed to do this work. Words cannot convey the importance of the work that Dr. Greenwood has done over 30 years. Our Indigenous children have a voice, as Dr. Greenwood has blazed a trail as a scout in being an advocate to our people. As she speaks of our Indigenous children and their rights under the United Nations Convention on the Rights of a Child. Creator, hear our prayers. Thank you for those who have come together in honoring Dr. Margo Greenwood. We thank the grandfathers and grandmothers for supporting and guiding us with this knowledge of well-being. Like a ripple in the water of life, may the teachings expand with every breath as the sun is high in the sky, warming us in the coolness of the northern energy, touching our spirit, asking us to come into the wisdom of our hearts. May the work of Dr. Greenwood continue, making the lives of Indigenous children and families' dreams come true. Creator, hear our prayers. Mother Earth, as we stand on you softly, connecting with your heartbeat, thank you for supporting us, allowing your essence to vibrate through us, interconnecting with all that lives in and on your body. We thank Mother Earth for allowing us to walk softly on her, leaving no footprints. Creator, thank you for being with us today. Thank you for leading us gently on our journey back to you. Let us be guided by your light. All my relations must see. Thank you.
Snachalia, Elder McIntosh. Snachalia is a word that Elder McIntosh has taught me to appreciate, which is, it means you honor us. And she's honored us with that beginning. And I know how important those kinds of sentiments have been in my own interactions with Dr. Greenwood and the learning that I've done with her as well. So it's a really neat moment because Margo, it is an interesting struggle for me, also being another Margo. But I'm Margo with a T. This is the other Margo that is often, it's been a real pleasure to see how many ways that she has been influential in these communities since I have been living on these territories. And of the many roles that she has, one of them, which you'll hear about shortly, has been some of her contributions to Northern Health. Margo is not only a member at UNBC as a faculty member and has contributed across First Nations studies and education and also the Northern Medical Program, but she has served at Northern Health in a very important role that we'll hear a little bit about today. And the person that's going to introduce us to that is also somebody that has had an extraordinary impact here at UNBC and in Northern BC. Kathy Ulrich, who is among her many roles, is President and Chief Executive of Northern Health, and a very well-cherished alumni of UNBC to have such leadership emerging from this university, and has had, I think we could agree, the good fortune of working closely with Dr. Greenwood for some time. So I'm happy to hand it to Kathy Ulrich to give the next introduction.
Thanks, Margo, and thanks, Darlene, for starting in such a good way. It's a real honor to be here, and I just really thank you for inviting me to be part of this. I know that later on we're going to hear about Margo's presentation, Dreaming It Into Being, the Realization of National Collaborative Center for Indigenous Health. But I'm going to talk to you about some of the other dreams that Margo has. And she's looking down. But first, before I talk about some of what she's contributed to Northern Health, I want to recognize the recent appointment of Margo to the Officer of the Order of Canada and to congratulate her. And Margo, we are so proud of you. Overall, the Officer of the Order of Canada recognizes outstanding achievement, dedication to the community, service to the nation, enriching the lives of others, and making a difference to the country of Canada. I learned that there's a Latin motto, which I'm not going to try to say for the order, but it means they desire a better country. And I couldn't think of a better way to describe Margo. She does desire a better everything in the work that she does, a better North, a better province, and a better country. So I think we can all completely agree that she's exemplified all those characteristics of the Officer of the Order of Canada. So as many of you know, Margo has been working as the Vice President of Indigenous Health and Northern Health for 8 years. And I've had the privilege to know her before then, and then to work very closely with Margo on our executive team. And I can tell you that she's had a very significant impact on our organization on healthcare services in Northern BC as well as across the province. So I'm going to describe for you just a few of Margo's contributions. When I first asked Margo if she would be interested in working within Northern Health, we started with when she was on sabbatical. She came and did 6 months in Northern Health, wanted to see kind of the operational side of healthcare. And that was such a good experience that I started to explore with her if she would be interested in taking on a vice president role within the organization. And particularly to bring some of the knowledge of the National Collaborating Center on Indigenous Health or for Indigenous Health into the organization so that we could take that knowledge and really translate it into policy and practice. And she's done that. I think the first thing that she did at the executive table was really challenged us in the most gentle of ways to think differently, and then helped us figure out how to do that, thinking both individually and collectively. And if you've been on the other side of Margo's penetrating questions, I think you have some sense of how those conversations unfolded. And a lot of it was done through stories, which was such a profound way to influence the way we think. Margo also helped us to understand the world through the eyes of Indigenous knowledge and experience and dream about a different way. She captured the imaginations of groups of staff and physicians and put together the supports and resources to enable that learning to be translated into policy and practice. The other thing that I'm profoundly impressed by with Margo is she is able to take some of our thoughts and plans and visions and translate them into implementation frameworks. And she does that extremely well, quickly, and with a great deal of insight and thought. And she's done that for us in relation to anti-Indigenous racism, cultural safety, and how we incorporate that into our organization. So I'll just give you a few examples. There's a cultural safety and humility video that if you haven't seen, you should see. It's a beautiful video that in 6 minutes kind of explains what cultural safety is all about. And that video has been translated into French and is used across the country. During the pandemic, she stimulated the development of a COVID-19 stigma video. We have in the organization also a document called Making It Real, Northern Health, Cultural Safety and Anti-Indigenous Racism Implementation Framework. And each of the executive team has commitments that they've made in that framework to action. We also have, and this is something that's going to really be used, I think, beyond Northern Health. There's a Northern Health Cultural Safety and System Change Assessment tool, and we're using that to assess policies and practices and services and to analyze those services. So those are just a few examples. There's many more. I think the most recent one is the completion of the Respectful Relationships, Cultural Safety, Indigenous Healthcare learning modules that are now situated up in continuing education here and will be used by Northern Health to educate our staff and physicians. The other thing that Margo has been able to do, I think, is support some of our staff and physicians to embrace their identity. And that has changed people, I think, quite fundamentally. And I do want to mention one other thing, because we are still in a pandemic. She did a lot of work last year with the First Nations Health Authority to develop the Rural Remote First Nations framework for response to the COVID-19 pandemic. And then more broadly, how can that framework be used in the province for rural and remote First Nations healthcare services more broadly. That became a provincial framework and was announced by the Premier about a year ago. So these are just some of the ways that Margos contribute to fundamental change in Northern health and healthcare in the province of British Columbia. So in summary, this is my experience of Margo. She's a visionary. She dreams about what is possible. And further, she's a builder, and one whose leadership brings those dreams into reality. So Margo, I think you do deserve to be a member of the Order of Canada. And I know that Canada's better for having had you in our midst.
So we just have one more introduction, which is just an indication of the scope of things that we have to celebrate here. And as I joked with Margo last night, she said enough already. And I said, we deserve to celebrate something. It seems like a good time to feel celebratory. And given that we are not just celebrating you as an individual, we're celebrating just how much you have enabled to invoke teams, not only at Northern Health, but also at the ways in which those at UNBC have been impacted. And so it is really my pleasure now to invite our Vice President Research, Kathy Lewis, another Kathy. We've got two Margos and two Kathys, I just noticed. And it's really a pleasure now to hear some of the perspectives of those connections here from Dr. Lewis. Thanks very much.
Thanks, Margo. And just listening to Kathy Ulrich makes me realize how much I've lost out by not having had the opportunity to work with Margo like all of you have. But I do have to say that while I've been climbing up the incredibly steep learning curve from my past profession as a forestry professor to acting VP research, I've had the opportunity to encounter and learn from so many people, so many inspiring people here at UNBC, and certainly Margo is one of those people. Her work as academic lead for the National Collaborating Center for Indigenous Health has had such a profound and positive impact on Indigenous peoples, and it pretty much blows me away what she's been able to accomplish. So research and scholarly activity at UNBC aims to have a positive impact on communities from local to global. And Dr. Greenwood has established partnerships and collaborations at the regional, provincial, and national levels that have contributed to greater awareness and understanding of Indigenous health. Together with collaborators, she edited one of the first books written by Indigenous people on determinants of Indigenous people's health in Canada, which addresses the many health disparities faced by Indigenous people. She's also led the development of many culturally appropriate resources for First Nations, Inuit, and Métis families. Through her leadership of the NCCIH, Dr. Greenwood has elevated the profile of Indigenous public health nationally and internationally, and her expertise has been sought by national leaders such as the Chief Public Health Officer, Dr. Theresa Tam. Dr. Greenwood is rightfully relentless in her work to draw attention to persistent health inequities experienced by First Nations, Inuit, and Métis people. She's played a critical role in creating space not only at UNBC, but across the country for Indigenous people to share their knowledge and experience on existing and emerging health topics. This work has been aligned with the dialogue on truth and reconciliation and the important discussions around the advancement of Indigenous rights, and has brought together diverse perspectives to enhance our understanding of the determinants of Indigenous people's health and well-being. But you know, one of the things that most impresses me with Dr. Greenwood's work is how accessible it is. Pretty much anything that she's written, any documentation she's been involved with, any of the tools that have been developed are there for anybody to access. And to me, this is so important, especially for the audience appropriate resources that really have elevated the impact of her work. So we are so very honored to have Margo Greenwood as a faculty member here at UNBC. Thank you.
Thanks, Kathy, for giving us some of the context that we're working in here. And I'm really glad to share that there's over 40 people online that are listening in. And so that's also adding to the sense of appreciation that we have here. So it is now my great pleasure. We're going to bring up that first slide and make sure that we've got everything set up in advance. So we're really glad to have a presentation from Dr. Greenwood about dreaming it into being, the realisation of the National Collaborating Centre for Indigenous Health. I will emphasise that after we've heard from Margo that there'll be some time for questions, reflections, comments, and there's some colleagues who can't be with us who are also looking forward to contributing then. So, my pleasure to welcome Dr. Greenwood. And we've got our
so good afternoon, Tansei. Chimigwich, Elder McIntosh. Thank you, Kathy and Kathy. I better not blow it, right? After all those wonderful words. Thank you so much. Thank you, Margo, for the opportunity. And I know how much work you put into this, so I'm really appreciative of that. So thank you to you. I want to acknowledge the ancestors and unceded territories of the lately Tenayas people and thank them for allowing me to work, live, and play on their lands. It's been a real privilege, so thank you. So how am I going to do this? Is the slideshow on here? Oh, sorry. Oh, okay, great. So it kind of warms my heart, as many of you, as some of the speakers mentioned, dreaming. And before I really get going on this, I want to talk about the image. Oh my goodness, don't show me that. I want to talk about this image. I grew up alongside the Battle River, and Margo Parks will really appreciate that, the Battle River watershed in what is now known as Central Alberta Treaty 6 territory, which is my home. And along that river was this amazing tree. Now, it wasn't indigenous to this area, but obviously the seeds had blown here and it had grown. And as a child, we used to play under that tree, and we called that our wishing tree. It was during these walks along the river and where I grew up that I learned to dream. That's where I learned to dream, to imagine. I never let go of that, that ability, I think, to dream and to think about something different. When you think about children and all their imaginative play, and then somewhere along the line they lose it. I don't think I lost it. I think I kept it. So I just wanted to share that because it really has influenced me throughout my life, and I heard you speak of it today. Okay. It's not moving. Sorry. Okay. Oh, thank you. So I divided this presentation into two parts, and it's really about the birth of the Collaborating Centre, the National Collaborating Centre for Indigenous Health. And you can see that I have divided into the beginning years, and then the second part is the work continues, as many of you in this room know. It begins with the story of the Public Health Agency of Canada was established in 2004 in a response to the SARS outbreak. impartial response. So it's interesting that we're still living in a pandemic now, but the agency was born out of that in 2003, became an entity in 2006, but it was in 2005, at the same time as the agency was being created, so was the National Collaborating Center created. That whole program was created in 2005. One of the real initiators, if you will, was Minister Carolyn Bennett at the time. And this was in part her vision of what could happen around public health. So you can see here that we were, there were 6 national collaborating centers created. We're the multicolored one. We were never conforming at any point. I think at one time they said, "Oh, you're going to be orange," and I said, "I don't think so." And you can see that they all are focused on different topics, but ours was the only population-based one. So we were serving First Nations, Inuit, and Métis people in the country, as well as all Canadians. That first year in 2005 was really a planning year. Here's a place you all recognize. We began the work by doing an environmental scan. We wanted to know who was working in Indigenous public health. We really didn't know that, and there wasn't really a lot of people. So we did a national scan on that. And when we were talking with folks, we asked them 2 questions. What areas of work should we focus on as a new center? And how should we govern ourselves? What should that look like? And those were the 2 guiding questions that brought us into a March 2006 meeting here at UNBC, where we invited over 50 people from across the country who were engaged in public health and Indigenous people together. I'll never forget that because we had the most amazing salmon dinner. It was so good. Sometimes you remember the food. Out of that meeting was born the National Advisory Committee. What also occurred out of that meeting was areas in which the group had told us to work. It was the determinants of health. So as you'll see, we have carried and continue to carry that theme: child, youth, and family health. So children and families. Emerging priorities. So we knew that as a national center, we needed to be responsive to people. We couldn't just say, "Oh, our budget's set. Sorry, you'll have to wait till next year." Like, that's your death nail. So we knew that we could not do that, but that we needed to be nimble and we needed to be responsive. And of course, this whole center is underpinned by Indigenous knowledge and Indigenous ways of knowing and being. And that guided the knowledge translation. That was the theme, or the mandate, if you will, from the Public Health Agency. I have to say, when we got the center, and it was under the auspices of Dr. Max Blau, when he first brought it to UNBC, and we got a 1-page memo saying, "We've created this program, could you please do this?" And that was it. Talk about dreaming. Fast dreaming was happening in those days. But we knew the importance of bringing people together that were already doing the work and engaging with the community. So you can see here at the very beginning, this was the goal that was given to us by people across the country, by our advisory committee, and you'll see the guiding principles. The goal really highlights health equity, Indigenous informed evidence, and we continue to ask a question: what constitutes Indigenous evidence? It's not the same. Transformation and change, we've never moved away from that. And this was a very beginning goal of ours and continues to be so. You'll see in the guiding principles, diversity, meaningful and relevant. So don't do busy work. Do something that's going to make a difference in our lives, in our communities. That was the direction. Be inclusive. I need my voice to be heard. And that was really important in the center. And then the privileging of Indigenous voices, where before there was very little privileging, if any. And it was important to bring those voices forward. Here's some of the ways, and I'm not going to read all these slides to you. I know they're kind of heavy on text, but here's some of the ways that we do create knowledge and the way that we put things out. And if you look at this list, you're going to see that we write in peer-reviewed journals, and we create pamphlets and videos. So it's a range of materials because we know that we have to reach many, many, many people. And we do want to point out the ways that I think are really important that we, when we think about creating the knowledge and that we ensure quality. We have a double-blind peer review process that's been critical to us from the very onset, that we weren't putting out material that was going to be harmful in any way to anybody. We needed to know that it would stand its credibility in an academic realm, but would be equally important to community. And that's an interesting path time to walk. We produced materials in multiple languages. We produced in Inuktitut, Cree, French, always French and English because we're mandated to do so, but we privileged Indigenous languages as well in some of our documents. We have found over the years that it's some of them are wholly, say, in Inuktitut. Other times we will have excerpts that will be in the Cree language or the Ojibwe language we've produced in Ojibwe. So there's a number of ways that we have profiled the importance of language to our being and to our oral identity. I think one of the things that's been really important from the onset was the visual identity of this center. We put a lot of energy from the very beginning into what this looked like and what it felt like. We wanted to know that if one of our documents was sitting on the doctor's office coffee table with a bunch of other ones, that those people would pick up our document. We wanted that. So we had a strong commitment to visual beauty, if you will, from the very onset. We wanted visual images that spoke to Indigenous people. So you'll see that a lot of our products are land-based because we can relate to the land, the place of our origin. And you'll see that they speak to the heart. And a lot of art speaks to the heart. And I think we don't create change unless we're creating using the head and the heart. So I knew the importance, if you will, of those things. Here's our website, just an image of it. I have to say that if you go on this website, you're going to find all of our resources, and they're all free and they're all downloadable for you to have to support you in your work. We have over 318 NCCIH specifically produced resources. That's pretty impressive in about a 15-year window. That's over 20 resources, documents, webinars that have been produced. Pretty impressive when you're thinking about putting out those documents. I want to share with you now some of those resources that we've created. Each one of them has an amazing story. And each one of them is associated with specific people. Many of you are in this room. And I'm going to get to you in a moment. I haven't forgotten any of you. I'm going to get there. But you need to know, like, people created them, people that are here, people that are not here, that have been associated with us. And it's been a very exciting journey to work with all of you. So let me show you a couple of those. I could not get 300 resources on this on a slide decks, and it wasn't going to, but they're all for you online on the website. But here's a few just to highlight. The very first dialogue circle we ever did was amazing. It really looked at the interfaces of different knowledge systems, and we brought together elders and scientists to talk about what happens when these systems of knowledge meet one another. What happens there? I'm also always mindful of Lisa Boyvin's art, who really speaks to that space and place a lot of times in her work. And I'll show you some of those. The second piece was Circles of Health, sharing our gifts. And it was our first gathering, and we always did national gatherings as series. It wasn't just a one-off, there'd be 4 of them. And so this was the very first one where we started to think about the social determinants of health. Because when we started that, people did, what are you talking about? What do you mean social determinant of health, Margo? What is that? I said, all those things that impact your health, all those things that impact your life, those are social determinants of health. And then we actually dropped that to say determinants of health after a while, because socialist can be quite restrictive, right? It doesn't think about geography or language or space and place. So that was our first foray, and that was in 2008 that we did that. Messages from the Heart was another series that we did, responding to children, youth, and family. And so we did a series around that, and that started in 2009. This was a policy document that we partnered with the UNICEF Canada. And it was one of the first documents that really brought forward and created a national awareness around First Nations, Inuit, and Métis children's health and well-being. It really furthered that conversation and that dialogue in the country. I'm going to try to go a little bit quicker here. I've got a few. Here's some more very exciting pieces of work, just so you can get an idea of the breadth. There's some more social determinants forums done in 2010, and that beautiful baby that's winking at you, isn't he the sweetest ever? I love him. Those 3 are images from the other 3 forums that went with the children, youth, and family theme. So there was one about With Dad. That's been so popular in this country, exploring what it means to be a dad, and hearing men, elder men, young men, fathers talk about that in this forum. The sacred space of motherhood is where that baby's giving you a little wink. And then the last of those forums was on family. The family is the focus. It was quite amazing. The Lake Journal was one of our first forays, and thank you to Sarah in introducing us to the editor of that journal. Was one of our first forays into starting to put in, have poetry and visual images, if you will, within a document itself that was providing that content. And so we were able to partner with Lake to do a very special journal. And I think that journal actually focused on health, Indigenous people, and place. So that was an amazing journey for us. Those fact sheets that you see down below are all focused on IQ. And I'm not going to try to say that. It's Inuit knowledge around children. So you can see the kind of breadth that we've undertaken over the years. And of course, there's our first book. I know that many of you are familiar with that. That's an edited collection around determinants of health and Indigenous people. It's quite a seminal text. There was nothing there when we walked into that space, and we continue to walk in that space. The second part of the journey, I think, for me has been the continuation of the work. When we were first funded, we were funded for 5 years. So we knew we had to get going and get producing things, right? And then we got a second 5-year renewal, and then we got a third 5-year renewal. And then I'm happy to say that this year we got an 8-year renewal. So by the time it's all done, it will be almost 25 years that the university will have the National Hiring Center for Indigenous Health, which is quite amazing considering that it's federally funded. Lots of times those last maybe 5-10 years and they're gone. We've been really fortunate, and I'm forever grateful for that. You'll see that nothing stands still. Everything changes, and it needs to. So we've evolved over time. We've evolved in our vision and our mission. We've held on to the very fabric that makes us who we are, but I think we've nuanced it. We've been responsive to social and political and cultural realities that we find ourselves living in. And you can see that the vision highlights self-determination now. In the early years, we did not use that term, although I think we did it. And in the mission now, it highlights the importance of partnerships. We've always known how important it is to engage with those we serve. That's who we serve, or those communities, those moms, those babes, those families. And so we've always known the importance of that, but we really wanted to articulate that in our vision and mission. Here you have what has changed. So did the themes change from the very beginning? Well, we kept all the ones we had and we added some. So we added chronic and infectious diseases. I mean, no surprise living in a pandemic that we wouldn't have that. But it's been really important. And chronic disease over time too is really important in our communities. We've also highlighted Indigenous knowledges. We've started to bring that much more to the forefront and to privileging that area. And so we really wanted to state that. And we wanted to state it relative to public health. So that's been really important. You'll see a list of repositories. We never had those at the beginning. Now we do. And I'm going to give you some numbers because I think it's pretty impressive. So the first number I'd already given you was 318 NCCIH specific created resources. And I think that underestimates, because in the early days we counted differently. So Donna was reminding me that we were counting differently in those early days. So I think we're underestimated. But let's talk about the repositories. COVID-19, 375 resources. I know that Regina has been working with about 900, but 375 are on the repository that you can access. 240 around tuberculosis resources, cultural safety and anti-Indigenous racism, 365. So these are tools, policies, academic papers, gray literature. It's a real spectrum for folks. Healthy land, healthy people, and this has been guarded closely with a particular criteria. And so we have 16 in there and we're working on that. We also have an incredible database that the team has put together of health researchers. And we have 397 people, researchers across the country who work in the world of health and Indigenous people. It's pretty impressive if you really are a researcher, a student, or a policymaker, decision maker, and you want to find some information in these particular areas. We have a lot of things there, I think. Now we're going to get to the fun stuff. So I know that a lot of our team is here, and honestly, I couldn't do any of this without the people behind me. So when you speak about the award, I always think about, I don't walk alone in carrying that award. I'm carrying that for a whole lot of people who supported me, who advised me, who walked the journey with me. And so from my perspective, That's how I think about it. So I really want to shout these out. Donna Atkinson is the manager. Now, Donna could run a small country, I'm just saying, and you guys cannot poach her, so forget it. Donna's been with me for well over a decade. In the early days on other projects, other initiatives, Donna was part of our team and has long been research associates. We have many. Sarah DeLeo has been with me for a very long time, over 2 decades, probably 23, 24 years, came to me as a first year master's student. I need a job. And then I sent her away to do her PhD and she didn't want to go. And I said, you gotta go. But we maintained a relationship. So it's been an incredible journey with all of these people. Regina Halseth came to me early, has been just solid backbone around the Collaborating Center and the work that she's done and contributed to the success of our center. We also have Roberta Stout, Julie Sutherland. Denise is here with me today. Denise is new to our team, came from across the country to join us, so very grateful to have her with us. Lisa Murdoch, who is in out of province as well, and Vivian Joavsky, I always say it wrong, who are just new to our team and they are not on site. Stephen Hardy is our communications person, incredible man. Jane Olson, who has been with me and keeps me on the straight and narrow financially, and I need that. Thank you, Jane. And then, of course, the person who controls my life through my calendar is Terry Delaney, and she's been with me almost, I think, probably a decade, just about, Terry, or more. And of course, Pam Adams is part of that team. So I really wanted to take the time to mention all of you because you've made such a tremendous commitment and avenues to the success, and you are part of it. And I want you to know that, and I want to acknowledge that publicly. Here's some more products we're going to take a really quick look at. I have to say that 3 of these products that are on here are through an amazing partnership with Northern Health. And I know Kathy mentioned a couple of them here, so you'll see them. There is no vaccine for stigma was a systematic review during COVID-19 that has just come out. There was a video that went with that, Healing in Pandemic Times, that Kathy mentioned. And one of my favorite people narrates that, Evan Adams. He just has this amazing voice and does incredible work. There's also how we build relationships and the importance of relationships and working together during these incredible times that we're living in. And that is that other video you see there, building respectful relationships. And then the document that you see there is one of the first in this country. Teresa Tam was developing, the Chief Medical Health Officer for Canada, was developing her annual report, and she commissioned an Indigenous compendium to stand beside it. So it's never been done in this country. So we were extraordinarily excited. A number of Indigenous physicians and people including the national Indigenous organizations, contributed to this document. So it's quite amazing, an amazing piece of work. So that gives you a sample there. Here's one more slide around some of the work that we've done. Wanted to show you that we do an incredible number of webinars and podcasts. I think I'm going to give you a few more numbers later on, but 110 webinars in the last 5 years. That's a pretty incredible number in the work that we do. You'll see the 2nd edition of the Determinants of Health book. There's a parenting booklet for Indigenous people, 6 to 12 years, which is a huge gap in this country. There's not a lot of that kind of stuff going on. We'll get the early years, we'll get youth, but we don't get those years in between. And so we saw a gap and we walked into it. We did some stuff on sports and recreation, which was a different area for us, but certainly a determinant of health when you're thinking about physical health. So I'm getting to my final slides here. And I thought it was really important to put in a reflection side. So what have I learned? What have we learned? When I look back on all of these years, 'cause it's been a while, I think there are many, many, many firsts, which I couldn't list here in these slides. I think the UNICEF document, I think the parenting booklets, the seminal textbook, the compendium to the CPHO report, and then most recently, an Indigenous specific chapter in the National Climate Change Assessment. Our team has worked diligently on that piece of work, and it's coming out later this month. So that's with Health Canada. So that's been an incredible amount of work by the team. What's been the impact? Have we made a difference? I mean, that's a question we all want to ask ourselves. We want to know that we've done this work and we've made a difference. Created knowledge where there was none. When we walked into this space, when the Collaborating Center was created, there wasn't a lot of documents that you could go to that really focused on First Nations, Inuit, or Métis people and public health. They just didn't exist. We've privileged Indigenous voices. There's a long list of Indigenous health scholars that have worked with us, where we've brought out documents, their writings. And I think we've done them a service. We've created a safe space for people to talk about Indigenous specific topics. I haven't said no. We've informed the creation of policy at multiple levels, provincial, national, international levels. We have done that work. We've supported educators and students across the country by providing quality materials. I think of the medical schools. I don't think there's one medical school that doesn't use some materials from the Collaborating Center. University health related programs use our materials. We supported the development and scholarship of students. We've had many students. Oh, I could tell you some funny stories. And academics through the publication of their works right onto a national platform. There's no in between. When you publish with us, you are in the national arena immediately. And I think we've used art in innovative and unique ways, and most of all, respectful ways of the people we serve. So when I reflect, that's what I see. I have a couple of slides here. I just want to show you really quickly about the importance of partnerships. And I think I talked about that. This is a web that we created. We were reporting out on this several years ago now. And so these are just an example of some of them. It's many, many more than that. But we really looked at who were our international partners, government, civil society, national Indigenous organizations, public health organizations, researchers, practitioners, communities, and individuals. So our partnerships were not just relegated to in UNBC or just not researchers. We went far beyond that. The scope is far beyond that. But it has to be, if we're going to transform and change how we think about many of the issues facing us today, especially those related to public health. That little girl is one of my favorites in the whole world. It's so wistful, and I want to be there. Here's another list: non-governmental organizations, professional organizations, academics. So just to give you a flavor of the breadth and the reach that the center has made and done over the years and used. Here's some numbers for you, which I think are really impressive. In the last 5 years, we've had 698,073 unique visitors to our website. That's not the repeats. Be well over 1 million with the repeats. 101,802 downloads of knowledge products. Hard copy dissemination, and we've been kind of curtailed because of COVID. 23,385 documents. We ship all the time, all over the country, documents upon request. Ask Pamela, she knows all about that. Webinars and podcasts, 110 we've done in 5 years. 240 knowledge products we've developed in the last 5 years. About 318, and that's when Donna was reminding me we didn't count in the same ways. We have an e-news that has over 11,000 subscribers. So it gives you an idea of the kinds of worlds that we move in and the uptake that has occurred for the Collaborating Center. Second to last slide here. Lessons learned. So Margo, have you learned anything? It's the important thing. Importance of relationships, and you've just seen me show those. Importance of creating knowledge products that inform practice, policies, and structural change. It is about change. It's always about transformation and change. Continued exploration of the interface between Indigenous and non-Indigenous knowledge systems. We are always interrogating and in that space and looking at it. How can we make it real? We heard Kathy talk about that in her making it. How do we make this real? How do we create something new and innovative in that space? It doesn't mean either one is less than the other. But how do we bring those together and create something new that's going to address the contemporary realities that we find ourselves in? Because the old may not do the job. We need change. Articulation of Indigenous specific evidence. It's one that I've grappled with for what does that mean? And it's one that I continue to think about a lot, especially as I find myself in different arenas. That question will raise itself up. And I continue to always think about that. And we need to respond. We need to be responsive to families. We need to be responsive to those we serve. So here's my last slide. Isn't that a beautiful image? That is our new book. Introduction to Determinants of First Nations, Inuit, and Métis Health in Canada. And it is coming out, I believe it is in August. So that is in that beautiful, beautiful art that you see there is Lisa Boyven. She's one of my favorite artists right now. And she's a student at U of T, and she's a Dene woman. She's done a lot of work in bioethics and ethics. So just an incredible individual. Opportunities for the future. So what are we going to do? How do we keep going? How do we keep moving? Continuing and expanding the Collaborating Center's applied research and knowledge translation. I know that sometimes people think that maybe this center doesn't do research or it isn't part of that process. Well, I'm here to say that's not true. I think we do a lot of applied research. I think we have a critical role to play in the research process, especially as we look at knowledge translation. I think we need to continue to search out and bring to the forefront those priority areas that impact First Nations, Inuit, and Métis people. I think we need to continue to develop resources that are accessible to everybody. We need to partner, we need to co-host, and we need to create. And I think one of the most important things, especially as I'm sitting here with my employers at UNBC, I think it's really important that we continue to provide opportunities for students in this university and beyond, because we certainly have supported students beyond UNBC. I think we continue to provide those research opportunities and those publication opportunities for our scholars and our researchers. And there's a last look at the wishing tree. And I thank you, miigwech for listening to me.
Oh,
right.
Nice try. I was just about to say that we'll keep you at that stage. And I think our fabulous multi-directional mic is going to mean that I can stand here.
Okay.
And you can, this will be, mean that people are able to see you while we create an opportunity for questions, for reflections in the room here today, but there's also some people that are looking forward to sharing their thoughts online. And so I'd really like to open it up very broadly. We've got a way for folks to write questions into the chat box that our team here will be able to read out if we do have questions. So alerting you online that this is a chance. And I also would like to, if there's somebody that is really keen to speak, we can upgrade you to a speaker and you can turn on your microphone if you'd like. But I'm going to look around the room here. I'm really seeing the fabulous NCCIH team in the background. I want to add my thanks and respect and appreciation for the way in which this kind of work has been supported through all of your effort. And I'm really glad that this presentation, which will be recorded and viewable, will also be a resource for people to understand just what a treasure there is here on campus and how valuable it is for us to be able to profile that broadly. So any questions from the floor here to open up with, or reflections? I've got people to shoulder tap, so one of the things that I wanted to reflect on is this is called the National Collaborating Centre on for Indigenous Health, but it has had international reach, and so too has Margo's work. Both through her own scholarship as an independent scholar, because there is a body of work that Margo has progressed herself and has fed into these kinds of leadership roles. So that international reach, we know that there were many colleagues from other parts of the world who were interested to attend, some who have apologized they couldn't be here. But I wonder, Dr. Fraser, if I know that there was some folks who hoped that you might be able to offer some of the reflections from, and I think it's fine if you come and stand here so that we can hear from you, if that's okay. Sure, Margo.
Margo, it is. Isn't it lovely to be here? We're supposed to stay away from it. Thank you. So hadi everybody, hadi sakuze, dinaze, skyze. The nena hunzu keo clearly tonight. Now I'm just going to flip it around to acknowledge the traditional territory of the Clately Tene from Polynesia. So aloha, aloha, palofa, ioranga, yola, me kia ora. He nui te mihi kia koutou. E noho mai ana tēnei kia koe tāle Iki atu tō kōrero tō karakia kia mātou. Nā mihi mō tēnā. Pera no kia tākuta Margo, Greenwood. Nāna I whakahaere nā kōrero mai I tēnei wā, mai e rā wā I Aotearoa, I Prince George nei, tēnei University, UMBC, ana ka te huriatia kia Jeff Payne, tō tātou rangatira mai UMBC, nui te mihi kia koutou, kia koe anō Margo, me Sarah Deleo, Donna, and their team, they were naughty, yeah. And I truly do want to believe you, but anyway, I'm here to represent Polynesia. They love Margo. Margo is naughty as well when she goes home. But you know what, let me reflect back to when I first met Margo, and that was in 1998, 1999. We had just started the Aboriginal Head Start program, and it was at a conference I met Margo. And I was up there presenting and talking about the importance of early learning, puna leo in Hawaii, kohana reo in New Zealand, and I came across Margo, and both her and I have early childhood education background, and we were so interested in how we can move, the 6 components of the vision of, the national, at a national level for Aboriginal Head Start programs. And so we talked, and Margo said we should get together. And my mistake was, yeah, sounds sweet. Yeah, let's do that. And so we got together, and we started, as Margo and I kind of got to know each other, and once again to build that relationship, and and looking at our responsibility as teachers and learners, and of course her vision. She was always dreaming, I mean seriously dreaming, and which is a good thing, because all my elders who really believed that Margo had that vision, was going to follow through with this vision of creating new knowledge and existing knowledge and bringing it to life. And so we carried on. We did an environmental scan for Head Start or early learning training, which was very rare at that time. And then we just carried on. But meanwhile, she was still talking about the health and nutrition. And actually, I was fortunate. That's where I met Kathy Ulrich. When we got the Head Start programs, I said, let's do a health circuit and bring your team together. However it is, we can work together. Back in the days. So thank you for that, Kathy. And we did. And meanwhile, here I'm thinking of, I'm getting ready to get out of the house as well, because I had spent a lot of time in health as a nurse. And so then Margo said, let's come up and let's do something together for the National Collaborating Centre for Aboriginal Health at the time. And we did. And she said 1 year is good. I said, oh yeah, that sounds good. 2 years, 3 years, 4 years, 5 years. I said, Margo, I've got to get a real job. I've just got to get a real job. She goes, yeah, okay, you do that. And so we did. But that teaching and learning kind, I could never get away from health. I can't get away from health. It's embedded in me. And I was able to take that health not only into education and to talk about it, but it's very different in education. But I'd say, here's some of the changes that I can move this information. For 15 consecutive years that I took the National Collaborating Centres packages that the girls put together, and just moved it over to nursing, and was able to share that with our nurse practitioners. And it was the most, and is still the most popular thing. And so when I think of, that was my determining health, because I'm marginalized at that time, was a nurse and, moving the information. And then I thought I was going to stop there until Margo said, let's go to Vancouver, we've got work to do. Then she turns around and says, you know that time when you said you were going to apply for the PhD? And I'm going, yes. She goes, now it's the time to go. And we go to UBC because she wanted to check in on her own work. So anyway, she helped register, and I said, I don't want to, Margo, I want to do something else. You're going to, so stand up here and we're going to, I'll give you the $100. So
You still
and
owe
that's
me
great.
that
I know, but that's the wonderful thing about it is when Margo and I graduated and we're on the podium on the stand. And so we're waiting, they're calling out our names and I'm trying to listen and she goes, by the way, did you ever pay my $100? And I'm going, are you serious? We're getting ready to get our PhD, stop that. But here's the thing, we've had, the journey was incredible and it will still continue. So I want to add that. So thank you very much, Ngāhi Margo, Kawe. and Kawe and Margo, and I will give you a hug. Well, we do that privately, but not in front of them. So.
Thanks, Tina.
Kia ora, Tina, and thanks for bringing the voices of so many of the other parts of the world that Margo has touched, and we know that that's only part of them. We've just mentioned Polynesia and many other places. We've got some reflections from people on the online, and some appreciations. One here from Henry Harder, just saying, hi Margo, my dear sister, like Tina, also reflecting back when we first connected some 21 years ago. What fantastic and fascinating work, well done, Natalia. But we do have some questions, and one of them is a question from Teresa Healy. Now I'm just going to try to find it. Teresa is going to be, is looking forward to joining us shortly. And there's lots of notes of congratulations that we'll make sure that we've taken and asked. But we have somebody, Bianca Michelle, who is also from Dakar Territory, saying, I had the opportunity to take a class and you led many, many years ago. So Natalia for helping shape my knowledge of First Nations health. And she was asking in an earlier question about, as a new research manager, what stuck out to me was the concept of creating knowledge. So she's just asking you to deepen that idea of creating knowledge as an Indigenous scholar and contributor. Can you just expand a little bit on that?
I'll do my best.
Oh.
That's a big question. When I was using, in this context, we have created knowledge products and taken information and made it accessible and purposed it in ways that was going to be useful to answer the questions that we were being asked. So I think about it a lot in that way. I think a lot of times when we come together and we have ideas, and we can share those and we put them into some kind of form, I think we're creating knowledge. And so I really encourage people to think like that, like to write, to articulate your ideas. Sometimes I draw. I have a book beside my bed that I draw, and I'm the worst artist in the whole world. That's why I'm the best appreciator. But I do draw out things, or I draw maps of ideas, and that's the way it starts. And then it begins to take form. But I take that thought and I apply it to a question. Like if a family says, "Can I do things this way?" Then I think about that. And I start to map these thoughts. For me, that's how it works. And I think when you are in a group where you can come off of each other, you only expand that thought and knowledge. And then you can be really creative about how you put it all together. It could be a webinar. Maybe we'll write a song. I'm the worst songwriter in the whole world, but I'm happy to try. But there's multiple ways. Sometimes we have to go and start from the knowledge we already know. So we go there We look at that. And then how do we build on that? It's like when you bring the interface of different knowledge systems together, it's going to be new. And so, you know, I think we have to challenge ourselves too, a lot of times, to think outside of the box. Like a lot of the innovation is not going to be in the box. It's going to be outside of that. And we need to go there. Like we need to, I think the greatest gift that was ever given to me in the Collaborating Center was the one-page memo that said, could you make a collaborating center? There were no boundaries away I went. Like what a gift, right?
Well, that's a tribute to the no boundaries thing, that you've been able, with no boundaries, you've been able to go so far. And there's a lovely question here from Teresa that jives with that so well. She says, when you look back on this is Teresa Healy, who is looking forward to joining us later in the afternoon. So when you look back on this amazing journey, what story stands out for you when you and your collaborators, with no boundaries, knew you were on the right path? Is there a story that you can share about when you had those feeling like we're doing it?
I think some of the most powerful affirmations of the work that we've been doing has come from community, and particularly from elders. When they come and say, you did good, then you know you did good. It's that little word has such depth. Of course, I could say to you, I published 10 of these and I received this award or that award. But what I think what's really meaningful to me is when those we serve or we strive to serve tells me a story about how it made a difference in their life. Because that's what it's really about, is that transformation of individual relationship and individuals living their lives on the ground. It's not whether I have the best policy or the best anything. Is what I'm doing making that change? And I asked myself that. And one of the things, Margo, the way I've answered this in the past too, is if you go back to the our guiding principles around relationship, the things that I showed you early on, those become your benchmarks. I can remember saying to myself, I can do this initiative. Is it meaningful? Is it respectful? Is it going to be relevant to people? And those became my touchstones that I would go back to on every product I made. I would go back and I would ask myself those questions.
And you've inspired a lot of people with the outcomes of that. I'm seeing we've had people calling in from New Brunswick through Saskatchewan, across BC, the mainland. There's a comment here from Julie Morrison, who's the Vice President for First Nations Health Authority Northern Region. And Julie says, many thanks, Margo, for your commitment and dedication. Thank you for all that you've been involved with at NCCIH. Quite impressive. Congratulations on being inducted into the Order of Canada. And there's lots of those kinds of messages here. Just the words about amazing inspiration. Thank you for sharing some of the steps along the way. But I am aware that we do have, we're eager to wind this stage of our celebrations up in the next few minutes. So I just wanted to make sure that there's not any burning questions from the floor here. Some of us are going to be proceeding and having a small COVID-friendly reception shortly. And I do want to really thank, as Tina did in her mihi in Māori earlier, acknowledging that it's really impressive to have so many VIPs across UNBC and other organisations here. I want to acknowledge Jeff Payne for joining us as well, and we're looking forward to some remarks from you in the next step of our proceedings today. But I do know that there, our colleague Daniel Sims, who has returned to these territories and is eager to be able to share. So I'm just going to make sure that we can see Daniel there, but I'd like to be able to put them on the
Thanks,
screen
Danielle.
here. Is that possible? Can you see?
Just stop
Just stop
sharing.
sharing.
Yeah.
Will you stop sharing? Margo?
Stop sharing.
I think everyone can see me now, right?
Almost, but I can, Margo can see you, and it may be that,
I can't see. He's not.
there we, oh, nearly, that's it.
There he is.
Look at that, Alex.
You can see him online. Go up.
Yeah, and these guys need to see him, so that's great, thanks.
Great. Well, just wanted to begin by saying that I apologize for not being there. I unfortunately got snowed in with the snowstorm that we're seeing. So I'm working from home, which if you are familiar with me, I have a lot of books, but I also enjoy reading them. But I wanted to just say that, first of all, begin just to say welcome. So Jakanche, which is hello in my language, and then just say, when I applied to become chair of First Nation Studies in the summer of 2019, one of the department members I was excited to work with was Dr. Margo Greenwood. So I looked at the UNBC website, I recognized her, although I'd met her in person. I'd actually met a number of her friends and colleagues while I was working at the University of Alberta, including Pat McCocus and Grand Chief Wilton Littlechild. They often say great people surround themselves with greatness. And if Pat and Willie were any indication, I knew Dr. Greenwood would be impressive. As a new employee in June 2020, arriving in the midst of the first year of the current pandemic, I found a relatively empty campus. One exception was Margo. So the National Center was busy at work. And it was kind of interesting seeing that when much of the campus was empty. She not only introduced herself to me, but also went out of her way to get to know me and support me as a chair and as a colleague, and I greatly appreciate that. Unsurprisingly, especially given her friends and family in the Indigenous community, Margo immediately began to talk to me about the best ways to decolonize the academy. And I do say decolonize, since Margo and I are in agreement that although a popular term, indigenization is a bad descriptor of what needs to happen. In particular, she quickly connected me with Northern Health, and it was with great pleasure that I could say that she spearheaded not only a new course for health science students at UNBC, which Kathy mentioned earlier, but also numerous professional development opportunities for current employees in the health region. When I first heard that Margo had received the Order of Canada, I was ecstatic. As an internationally recognized scholar, activist, and strong Indigenous woman, I cannot imagine anyone more deserving of this honor. Margo, it is an honor to call you a friend and a colleague, and I look forward to seeing what you do moving forward. And I know your ancestors will notice that. And I will begin with a word in my language, wazoo. So well done, congratulations. And again, my apologies for not being able to be there.
Snap Charlie, Daniel, thank you. Margo, do you want to reply? That's great. And we'll.
Danielle, thank you. Can you see me? Oh,
He can
yes.
see you, yeah.
Danielle, thank you so much. It really means a lot to me, and it's been a real pleasure working with you, and I look forward to many more adventures in UNBC with you. Chimigwech.
Wonderful. So with that, I'm going to just offer a couple of final remarks, and I do want to, I really want to thank you, Margo, not only for this incredible body of work, but you made an effort to come and share it with us. It was an invitation that also required effort, and I'm so glad. I'm really glad that it has been able to be a special presentation, that even though we know we're touching so many people beyond the room, that the people in the room here today, I think will all be really glad that they've had this opportunity to spend time honoring this important work. And this is now going to be a wonderful record that can be shared along with all those other amazing resources, not only on the NCCIH site, but on our Health Research Institute site, and forms part of the record of inspiring work that's done from these halls and far beyond, with impact and transformative ripples that I think we're going to see for a very long time. So with that, I really thank you all for being here on behalf of the Health Research Institute, UNBC, and all the others who appreciate your work. Thank you, Margo, and thanks everybody for being here. We'll bring this to a close. So we'll end the recording